ما أريد من هذا الشعب إلا أن يزيد في الحمد والشكر إلى الله عز وجل، ويزيد من محبة الوطن، ويزيد من العمل ومضاعفة العمل لما يسعى فيه من خير له وللدولة والأهل. هذا اللي أنا أدوره من الشعب، وربنا إن شاء الله يوفقنا جميعا على ما يحب ويرضى.
I would like to thank you very much for the opportunity to come to your amazing country that I found so safe, so welcoming. As a female, I've been able to elevate my career to even new heights. I feel that all the opportunities here are there for the taking, and you've provided amazing infrastructure from a healthcare point of view for me to be able to give the best care to my patients. And I'm really thankful for being able to come here and make a difference. So thank you very much.
Welcome, ladies and gentlemen, to your favorite program, Peers of Union, which invites the most successful people here in the UAE. Today from Dubai in Saudi German Hospital with Dr. Kaminski, consultant pulmonary diseases, one of the most important doctors here. Welcome, doctor.
Thank you very much. Thank you.
Thank you. So we are so pleased to meet you today, doctor.
Thank you. It was my pleasure to meet you guys.
Yeah, thank you so much. Doctor, today we'll talk about your success story, about your journey, about your career and your experiences here in the UAE. So in the beginning, we need more details about you to present you to everyone. We need to speak about your professional experiences and your educational background as well.
Thank you. So I've been here in Dubai now for 12 months, and it's been an absolutely fantastic 12 months of my life. So the background about me, I born in the United Kingdom. My dad is Egyptian, my mum English, so had, I think, the best of both cultures. Grew up and always knew I wanted to be a doctor. So was the first doctor in my family. Just had this overwhelming desire to make a difference, to help people. Was always interested and fascinated by the human body. So luckily worked hard at school and got offered a place at Imperial College London, where I did my undergraduate training. I always had a fascination with breathing. I thought not being able to breathe would be the most awful thing in the world. So I did a BSc in respiratory medicine as an undergraduate at the Royal Brompton. And then that passion just carried on, really. So I did my training, my postgraduate training, my specialty training in London. And I was lucky enough to have training again at the Royal Brompton, which is, you know, renowned as the leading heart and lung institute in the world, under some amazing professors. And found a real love for infection and for airway disease like asthma and COPD. And then became a consultant pulmonologist after doing lots and lots of exams. So I did my MRCP Part 1, 2, PACES, and then I did a specialist respiratory exam. And then got my consultant job in the NHS in 2018, and then worked 5 years as a NHS consultant, and obviously navigated COVID as a pulmonologist. So that was again a very steep learning curve, but really, you know, I've had a really enjoyable career. Took part in lots of research early on, was on multi-centred global research collaborations, had publications in the Lancet, was able to be the principal investigator for many studies, on advisory boards for the British Thoracic Society, and sort of collaborative in writing guidelines and being a specialist on things like asthma and diseases. So had quite a varied career back in the UK. Also had a passion for teaching, so had lots of undergraduate medical students that if you can impart your knowledge to them, that was fantastic. And then postgraduates as well. So sort of had that side of my career, which I've thankfully been able to bring over here to Dubai and been able to continue over here. So I think lots of parts of my job that I've been able to bring here, and I'm really enjoying everything.
Yeah, what a faithful journey, doctor. So, doctor, being a doctor, it's a noble profession, and being in the world of medicine, it's a nice experiences. But, being in the world of medicine, it's not easy at all. This profession needs more experiences, need deep knowledge. Of course, you have faced lots of challenges during your journey. If you can mention to us some of these challenges.
Yeah, of course. So actually getting into medical school in itself is very difficult when you haven't got the background of, family and medicine. So seeking out work experience. I actually did nursing when I was a teenager. Used to go and help people and look after people and wash and dress them. So to get experience of caring for patients and understanding that, and always seeking out opportunities. So I always think you should listen to what somebody has to offer you and listen what they have to say and say yes at every opportunity. So I then was able to take part and do some research before going to medical school. So I spent my summer working in a laboratory in a hospital, looking at tuberculosis and infections. So, giving up your free time to advance yourself so you can get into places and then, get the best opportunity. And then navigating being a doctor, it's an amazing career, but it impacts you. Every time you see your patients suffering or in pain or, they have chronic disease, it really impacts you, and you have to become very strong to understand and have that empathy, but also then to go home and be a wife and be a mother and be a daughter. So you have to become very strong. But I think when things stop impacting you, that's when you know that you shouldn't be a doctor. Because for me, it was amazing to be in work and feel everything that my patients feel, and then come home and reflect on that and appreciate all the things you have, having your health, having your friends and family around you. So I feel very lucky. The other thing I guess that was difficult is all the exams. So not only working full time, but then you do all your exams, all your research. So the amount of time you spend, and then always making sure that you're up to date with everything. So collaborating with other international professionals from around the world is really important. So making sure you have that time and, using your free times to go and do things. For example, in 2 weeks' time, I'm going to Brazil to do some work on respiratory viruses. So using my free time to go and do that, but something that I'm passionate about and really believe in. So you make sacrifices, but the reward you get is tenfold. Mm-hmm. And when a patient comes back after you've given them some treatment and they're better, that in itself, that fills you up, and then you get to go home and you see your children and you be able to tell them, that you've made a difference. And, for them to say, well, Mummy, you're our hero, my daughter Maya and my son Josh, I feel really proud that, they are proud of me.
So, doctor, by patients hardworking and ambition, determination, also we can achieve these challenges, but also we need our supporters, persons who always stand by our side. So who are your supporters? Persons who have supported you, inspired you and motivated you during your journey to overcome these challenges.
So I think I've been extremely lucky. I've had a very supportive family. So my mum and dad, absolutely amazing, very, very supportive, came from a very humble background. You know, we didn't have very much money. We never went on holiday, but any spare money they had, they sort of would invest in us to make sure I, you know, could get the best education I got. You know, my mum and dad were brilliant, and just always like fighting for us to be the best. And that, I think, is the most important legacy you can give your children, to, you know, encourage them to take chances, to be able to make mistakes, to be able to fail and learn from their failures, and just to always strive for the best. So my mum and dad, really. And then now in later life, my husband, his amazing family, and my 2 children, who understand that even though this weekend I wasn't working, you know, I had inpatients and I had to come to the hospital for a couple of hours, and that meant that our activities had to be structured around that. But understanding that, you know, if mummy was poorly or daddy was poorly and we were in the hospital, they would want their doctor to come in and make sure that they were better. So that sort of understanding and encouragement. And, you know, my husband always, you know, I'm me working late or going on a course or doing something, you know, it's not the traditional role that my husband's always really supported me in everything with our family. So I feel very, very lucky. And then amazing friends, you know, when you've had a hard day at work, just kind of somebody that you can talk to, other medical professionals. You know, you come here, it was just my immediate family, and you quickly have to make friends. So we've made some really good friends, both, you know, in the medical field, but also people that don't do medicine, that are doing, you know, working hard, setting up their lives here in their own capacity. So all supporting each other and encouraging each other. It makes a big difference. And, you know, that being able to offload and, you know, saying today was a hard day, today I cried, you know, that it's important to have somebody you feel safe that you can do that with.
Yes, doctor, you have a supportive environment. So, doctor, now let's focus on your specialty. Be a pulmonologist. Is it a simple choice or an ambition to you from childhood?
So I've always been fascinated with breathing, and, you know, it's the first thing, if you're in an emergency situation, it's the first thing you check for, airways and breathing. And not being able to breathe and being able to help somebody breathe, for me, was such a drive to become a pulmonologist. And I love the fact that in my disease speciality, I get to deal with people that are acutely unwell with nasty pneumonias, blood clots, you know, so I have lots of acute things that I can do, but I also have the chronic patients that I get to spend, you know, hopefully my career lifetime with them and a long period of their lives with them. So I get to take them through that journey. So my patients with chronic asthma, with chronic obstructive pulmonary disease, with bronchiectasis. So I have both the acute and the chronic. I have the young patients, the elderly patients. For me, it has everything. I have interventional things I can do. So later on today, I'm going to do 2 bronchoscopies. So I get to do some procedures where I go into patients' lungs and take biopsies. I get to put drains in if they have infections outside their lung. We get to do emergency life-saving things like retrieve blood clots and break them down. So for me, it was a real, I wanted to be a pulmonologist, and it's a hard career to do. You have to, you know, it's very competitive. Lots of people applied. I remember when I got onto my specialist training, there were hundreds of applicants for 3 seats, for 3 training seats. And then to get the top seat to be able to train at the Brompton was, again, you know, I had to prove that I was determined and that I was going to give everything. So it's been hard, and I've had to do lots of extra things, research, you know, understanding things, deep delving into disease specialities to be able to become an established pulmonologist here. And very much my area of expertise is severe asthma, severe COPD and bronchiectasis. So these are the areas I really work hard in to make sure that I'm at the forefront of it, and that, you know, I can be an international expert and that people can feel safe in my care from around the world and here in Dubai. So I know what I'm doing, and I know that I'm giving them the best possible care I possibly can.
Yeah. So, doctor, today we live in a competitive world in the UAE and especially in Dubai. So, how did you maintain your name and being among the most important doctors here? How were you able to achieve this recognition and interest despite the high competition here?
So there are some absolutely fantastic pulmonology doctors here, and there's lots of societies and lots of collaboration. So I think understanding what there is here and then how you can add to that. So I only came a year ago, but I came with sort of drive, determination and passion. I wanted to set up a severe asthma centre so we could be a place for second opinions, third opinions, people to fly in from around the world to know that they would get expert care, that I could break down what type of asthma they have, what treatment they need, what else is going on. And so from that, I've really just been very ambitious from the get-go. I've collaborated with other experts in my field. I've maintained my international relationships with professors from throughout the world, made sure I'm collaborating on all new treatments. So we were the first hospital here to give some of the biologic treatments for severe asthma, making sure I'm sort of at the forefront, knowing what's coming through from a research point of view, continuing my research, still overseeing investigations looking into how tweaking treatments can really impact on patients. So I've done that. I think also from word of mouth, so patients have come and they've had really good responses, so they've then spread the word and my practice has became very busy very, very quickly. And also talking to other healthcare professionals. I love educating, I love teaching, so giving me a platform to talk about vaccines, to talk about specific biologic treatments for asthma, talking about new treatments that are coming in for chronic obstructive pulmonary disease. They're going to really change the landscape of that disease process, has been really inspiring for me to get my teeth involved. And here it's been even faster moving than the UK. So everyone wants this to be the best place in the world to come for healthcare, and everyone is there. They say yes, everyone is there to collaborate, work with you. You ask for a new bit of equipment, you ask for papers on this, you ask for, can we be the first treatment to place in the hospital to give this, and everyone always says yes. And they work with you to do it. And then working obviously with other fantastic pulmonologists. We've got our Emirati Thoracic Society group where we have meetings, flying all over the world to collaborate with people, just making sure that I'm there doing everything that I can to make sure I can do the best for my patients.
Of course, doctor. So, doctor, as a pulmonologist, in your point of view, what are the needs of citizens here?
So for me, there has been a big shift in my patients understanding that they actually have chronic disease. So a lot of patients find it very difficult to accept that they maybe have asthma, or they haven't been told that they have got asthma, and they just call it like seasonal allergy, where they have some treatment for one or 2 months every year. And then over time, slowly that chronic disease is ticking away and they're getting disease progression and they're ending up with more severe disease. So for me, that's been a big thing that I feel I can impact on, actually really getting patients and other healthcare professionals to know that this is a chronic disease, that actually without proper treatment over time, they're going to get disease progression, worse disease, and actually highlighting those patients that are having reoccurrent steroids, that are needing to go to the emergency department, that they haven't got control, and that this for them poses a risk. Unfortunately, millions of people die every year still from asthma. And I don't want that to be a statistic, because we have got treatments now that can prevent this. So really changing the landscape across the healthcare and across patients so that they know that there are treatments there, and making patients know what type of asthma they have, what means they're at risk, and having that treatment. And there'll be those that will need intermittent treatment, but at least knowing what then to take when their symptoms get worse. For me, this is fantastic. And then the new thing now coming in is actually we've got lots of patients going around with chronic obstructive pulmonary disease, which is a smoking related lung disease. And they're in the early stages of it, And if we can diagnose it early and do interventions early, like stopping smoking, like starting them on inhaled treatment, then we can hopefully change the landscape of this progressive disease. And now at the severe end, also having treatments now for them, and being one of the first countries in the world that's going to be able to offer this. So there's a big need here. There's also, we're a centre for where lots of people fly in all the time. We have lots of infections. We have atypical infections. And getting on top of this, getting patients treated promptly on the right antibiotics, making sure that they haven't developed scarring, is also really, really important. So for me, I feel my subspeciality is served very well here, because this is what pulmonary disease represents here in Dubai and in the United Arab Emirates. So it's the best place for me, and I feel like I can make a big difference.
Yeah. So, Doctor, now let's focus more on your career and on your journey. Of course, during your long journey in the field of medicine, you made lots of achievements, lots of accomplishments. Can you please share with us some of these achievements?
Oh, no, I feel like I've done well, and it's nice to always be recognised when you've done something well. So back in the NHS, I got Clinical Excellence Awards. So that's when you're sort of going above and beyond, making a real difference to patients' care. So I got that a couple of years in a row. I also was asked to be part of the British Thoracic Society Advisory Board as an expert. Got asked to collaborate on lots of research, publications, be a principal investigator. Was heavily involved in all the COVID stuff. One of the first places in the world to give both COVID and influenza vaccines together, and was able to publish that research in the Lancet. Other achievements that I've made, obviously, I've done all my postgraduate exams, passed my specialist respiratory exam. Since I've been in Dubai, I've been able to bring some of that research in, but I've been made the medical director of interns. I love teaching junior doctors. I love instilling the passion that was instilled in me when I was a junior doctor, and helping teach them and shape their career, and being a mentor and being someone that they can trust. So this will be the second year of intake that we'll take for interns. We have about 15 interns that are in their first couple of years of being doctors. And now I've also been made the internal medical director for internal medicine. So that's sort of general medicine. So starting up a program that's by the DHA here. So, we're going to be able to train our doctors up to be world-class doctors, to go wherever they want in the world, and be the best, and have all the facilities, all the teaching and training. So I'm really, really proud of these accomplishments, and being given that recognition from the DHA and from my workplace.
Yeah. So, Doctor, the development in technology is necessary in our life. Today, we are talking about the artificial intelligence. So, does development in artificial intelligence serves the world of medicine in general and in your specialty?
So I think artificial intelligence is amazing. We're using a computer learning program that can find patterns, can recognise at-risk patients, can look at an X-ray and see areas where there might be something developing, and then go on to highlight these patients to have CT scans. I think it's a fantastic tool that we need to use with us. We've got robotic surgery. When I do bronchoscopies, specialist areas that can highlight maybe areas within the lung that look abnormal, that then can highlight where I biopsy. So I think it will make medicine more precise. It will mean that we're able to deliver more precision medicine for individuals. I don't think we're ready to be taken over. I think you need that personal human approach, and things you pick up on. Even during COVID, when I was having video consultations, you miss a lot from when your patient walks into the room and you have that patient-doctor interaction. You see how they sit in the chair, you see how they relate to you, you see if there's something that they haven't told you that they want to tell you with their body language. So using it together with obviously the training that you have as a doctor is really important. I don't think it will ever take the place of doctors, but I think it's a fantastic, exciting field, and I think we should embrace it and be using it collaboratively across all medical specialities, and particularly within pulmonology.
Yeah, but doctor, talking about surgeries today, robots perform surgeries. So what is your opinion about the idea that in the future we'll see that doctors being replaced by robots?
So I think some aspects of medicine will be better served by, that precise, you haven't got the human factor where, there is error, there are mistakes, but I think you always have to have the two side by side. So for here, example, in my hospital, they perform robotic assisted surgery. You still need your physician there. You still need to see how things are done. So they help shape the hips and put them in, and it's robot assisted. But I don't think they'll ever fully take the place of doctors. Particularly not in my speciality, where there's a lot of stuff that happens that's not, it's not black and white, it's grey. And you need to understand your patient, understand your patient's concern, also kind of see the trajectory and get a feel for how things are going, and with that experience. So I don't think it will ever take the place, but I think it's a fantastic tool, and we're in the most exciting era in medicine, and hopefully we'll be able to prevent diseases in the future, and mean that our patients can live healthier, longer lives.
Doctor, today the UAE is the best destination for the health care in the world, and today the UAE is the best destination for the medical tourism. It attracts people from all over the world to come here to find the best of doctors, the best of nurses, and best of treatment. So how do you see the healthcare here? How do you see the treatment here? And what is your opinion about the medical tourism here in the UAE and in Dubai?
So I was amazed at the extent of medical tourism here, and how many patients, as you say, fly in from everywhere. They fly from America, they fly from the African subcontinent, they fly many hours to come here to seek the best care. And I came from the NHS, which is a fantastic training ground, fantastic structure, but I couldn't deliver the kind of care that I deliver here. A patient can come to me with respiratory symptoms, can see me, I can organise testing, specific breathing testing, blood testing, imaging, and see the patient within a few hours with all of these results and make a decision about treatment. So it's fast paced. It means I can collaborate with specialists. I can get them seen by a consultant, a cardiologist. I can get them seen by neurologists, by doctors that I trust and know that are experts in their field, and collaborate with them, have MDT meetings, which you just don't have I didn't have the infrastructure to do that within the NHS. So the type of treatment and care that I can give is absolutely fantastic. The technology that we have here is amazing. The other healthcare professionals, the nurses, we're very, very lucky that we can really give the highest standard of care, but also have, the licensing and the rules in place that mean that you have to give gold standard care, that you have to follow guidelines, that you're doing the right thing. And this is very much coming in here, so that everyone is getting the same uniform treatment, that it is the best treatment, that it's, guideline driven, that they're getting the right treatment at the right time in the right place. And the fact that the authorities are bringing in these guidelines for oncology, for infection, antibiotic stewardship, all of these things are really, really important, so that you're doing the right thing, not only for your patient, but also for the whole of the citizens of the United Arab Emirates. I think it's very important, and I'm excited that I'm here, because I believe that now the next 20 years of my career are going to be very fulfilling, and we'll go from strength to strength.
And how do you see, Doctor, the policies and the important laws here that established by the UAE and applied throughout the medical sector?
I think the laws here are very great. Everything is very black and white. Everyone knows what they can and can't do, and it's a very safe place to be. And also from a medical point of view, there's things in place to protect your patients, to make sure that they get appropriate treatment. And even within ourselves, writing procedures, writing guidelines. So if a patient comes in with a pneumonia, this is the treatment that they get. If a patient comes in with breathlessness, these are the investigations that they get, so that everyone is getting the same uniform gold standard treatment. And this is set up by the DHA. And now with our training of junior doctors, we can then establish that and make decision makers of the future. So the laws are there. The fact that the government see it as important to have that uniform treatment and the safety for our patients as paramount means that I can practice in a way that I'm giving the right treatment, and that I know I'm giving safe treatment, and I can trust my colleagues to do the same.
Yeah. So, doctor, after your faithful journey and rich experiences, and also thanks to your deep knowledge, today you make a successful story. So, you know, the word of success is not strange to you. But, you know, this word is a subjective word, and it differs from one person to another person. To you, doctor, what is the meaning of success? How can you define the word success today?
That's a really hard question, but a really good question. I think you can have success on a daily basis. So for me, if patients come in and I've made a difference to them, that's success. If I have been able to collaborate and move things forward for the future of that patient, for other patients, that to me is success. Mm-hmm. If I can go home and provide a good standard of living for my family and my children, that is success. And if I feel fulfilled in my heart and, you know, I'm happy, can genuinely smile on the inside and the outside, that for me is success. And also knowing that, you know, every day is different and, you know, being helped by those around me, helping those around me, being a good person and having good come back to me, that all to me tells me that, you know, life is successful and that I'm a very lucky person.
Yeah, well, great, doctor. So, doctor, now we need your advice to the new generations of doctor. You know, lots of people from audience, they are new generations, and they see from your story something special inspired them. They are the new generation of doctors, and they are looking for the key of success. So what is your advice to them?
So I think if you want to be successful, you have to be open to failing. So not everything is always going to work first time. When I was at school, we had a headmistress, and I didn't understand it at the time, but she used to say, you haven't tried if you haven't failed. So actually pushing yourself beyond your comfort, always saying yes to opportunities, being open, being courageous, and believing in yourself. And if you have a goal, just keep trying, and you will get there. Because if you want to do something enough and you put yourself out of your comfort zone, you will achieve it.
Yeah, what a great advice, doctor. So, doctor, you know, also the UAE has for sure contributed to your successful story. So, what is your appreciation message you would like to convey through our episode to the UAE and its rulers?
I would like to thank you very much for the opportunity to come to your amazing country that I found so safe, so welcoming. As a female, I've been able to elevate my career to even new heights. I feel that all the opportunities here are there for the taking, and you've provided amazing infrastructure from a healthcare point of view for me to be able to give the best care to my patients. And I'm really thankful for being able to come here and make a difference. So thank you very much.
Yeah, thank you, of course, the UAE for giving us this opportunity to be successful. Thank you, doctor. We are so pleased to meet you today. It was really my pleasure talking with you, and thank you for this meeting. Thank you for these details. Best of luck.
Thank you so much. So lovely to meet you. Thank you.
Dear audience, this is the end of our episode. Watch us next week. Goodbye.